Hi everyone, and welcome to my channel. And on this very video, I want to talk about referral system in the healthcare setting. It's important for us to note that a lot of cases that leads into complication would have been managed earlier on if the client was referred quite on time. And it's important for us to note that most clients that were lost is a result of the caregiver not knowing when they should refer the client out of the facility. And that's why you have more facilities suffering from lack of clients visiting them, because most persons have this perception that if they go to a particular facility, there is possibility they may not return back alive. That will take us to what a referral system in the healthcare setting means. Referral in the healthcare system simply means the transfer of clients or patient from one facility to another, from one healthcare giver to the next healthcare giver, either within the facility or outside the facility. So we have three major types of referrals. The first one is the one-way referral system, where the client is sent from one healthcare facility to the next healthcare facility for expert management, and feedback is elicited at the end. Two-way referral system is the process whereby a healthcare giver in one facility sends out a client to the next healthcare facility, and then the client is also referred back at the end of the intervention that was rendered in that facility to the facility for which he or she was referred from. This is for the purpose of expert management. For instance, a facility that has ophthalmologist may refer a client to a facility that have gynecologist because the clients have a gynae issues, and this does not mean that the client would leave totally to that facility where he is offered gynecological care, but rather because the clients have concerns with gynae cases, right? And then will now return back to the facility where the ophthalmologist will see him for his ophthalmic concerns. That will take us to the third type of referral system, which is the multiple referral system. This is a system whereby a healthcare giver, a doctor or a healthcare personnel in one facility refer a client to another healthcare facility and also to another healthcare personnel in another healthcare facility, and then that facility refers the client out again to another or a new healthcare facility for expert management. So this happens where a client have multiple concerns, where the client will now be referred to different facilities for management, and feedback is elicited at the end. It is also important for us to know that there is another word called transfer. The difference between transfer and referral system is that in transfer, the client is only moved within the facility but to different departments. So where the client is moved from outpatient department to emergency department, or from emergency department to surgical outpatient department, it is called transfer. All right, but when the client moves out of that facility entirely, it is called referral. Now, what are the benefits of referral? Referral saves time. It provides the opportunity for expert management to be rendered. It also provides the opportunity for a more advanced and critical look into a condition. Referral makes it possible for advanced material and equipment to be used on the client, because some facility may not have advanced material to handle the condition. It also promotes professionalism, whereby one client moves from this expert to another expert, and then feedback is elicited within the healthcare system. It also saves time. So it's important for us to know that where complication would have set in, referral will help to save time. And it's also important for us to note that referral also saves finances, because most clients are referred out because they may not have sufficient finance to cater for their healthcare condition or to cater for their healthcare services. It's also important for us to note that referral promotes expertise, because if you don't have certain condition referred to you, where you are faced with that condition for the first time, you may not handle it optimally as compared to where you have handled the same condition severally. Now, what are the indications for referral? A client should be referred out where complications is expected in that condition. A client should be referred out where sufficient hands are not available on ground to handle the condition. A client should be referred out where there is no expert as referred to that condition. And then a client should be referred out where there will be wastage of time. A client should be referred out where the facility have a high workload, instead of delaying the client for chronicity to set in. A client should be referred out where the client does not have sufficient finance to aid or to cater for his healthcare services. A client should be referred out where there is no advanced material to handle the condition. A client should be referred out where the clients have religious concern. Are there disadvantages to referral? Yes. Where there is advantages, there is also possibility for there to be disadvantages. So what are the various disadvantages of referral? Just as referral will save time, It also in other instances would also lead to complications because the distance from one facility to another facility may be the reason for the complication. Referral also can also lead to a poor management where you transfer the client to another facility or you refer the client to another facility and then the expert is not on ground to handle the condition. Referral also could lead to a poor management where there is poor communication. Referral, on the other hand, can also cause a delay in management where the next facility also have a high workload on the ground. Now, what are the hindrances to referral? There are certain obstacles that hinder referral in the healthcare system. One, pride within the healthcare givers or the healthcare personnel. So the consultant may feel that he or she will be looked down on if he can't handle that condition and will want to do trial and error. And also, there is another thing we should note, that religious or tribal sentiment may be a reason for a referral not to take place. It's also important for us to note that poor finances may be a reason for referral not to take place. So where the client would have been referred out for expert management, he or she may feel that he doesn't have sufficient finance to cater for that healthcare service in that facility that he or she is referred to, and so would want to give opportunity for trial and error instead of being referred out. And it's also important for us to note that some facilities may depend on improvise, where they have seen clearly that they don't have enough material equipment to handle the condition. They want to improvise just to see if they can handle the condition. It's also important for us to note that incompetency may be a factor where the healthcare giver does not know when to refer the client out. And also the thought or intention to press further, where there's a clear line or indication to refer the client out, may be a reason for a client not to be referred. At this point, we have to end here. If you have any question or any concern as you refer to referral, or you have a story to share as referred to referral, where maybe you lost a client or you lost a relative because the relative would have been clearly referred out but was not referred out, let me know in the comment box. And I look forward to that moment where this particular channel becomes your most favorite click. But for now, stay safe and remain blessed. Cheers.